Hello, and welcome to the webinar on the evidence review information for 2024. We wanted to point out that the email you received from CastlePost should say you are one of 80 selected, because this is for the evidence review and you're at the correct webinar. If, on the other hand, your email says that you're one of 100 selected, then you were selected for a peer assessment and you should be watching a different webinar. But we're really glad that you're joining us today for the evidence review webinar, because process is different from how it was in 2023. My name is Dana Prucci. I'm a speech pathologist and the Director of Professional Practice and Quality Assurance. I've been in this role for almost 3 years. I really love talking to people, spoken to a lot of people about peer assessments over the last 3 years, and understand that this can be quite anxiety provoking. But almost all the registrants who have been through peer assessments say it was a valuable and positive experience. And so our goal today is to give you lots of information to help you through the evidence review process. With me today is Samita Joglekar.
Good morning, everyone. I'm Samita. I'm the advisor for audiology practice and quality assurance, and I've been at CastlePost for 6 years now. Like Dana, I've answered lots of questions from registrants on both peer assessment and mentorship. And we're here to give you some guidance today, hopefully to give you some good information that will help you with this process. As Dana said, we know it is anxiety provoking, but we hope that this session will be helpful, and we're here to answer your questions.
As always with GoToWebinar, it's best to close anything else you have running on your computer at the same time. If you do have any issues, maybe the sound isn't working, then you can back out of the webinar and then restart it. We've both been talking about answering your questions. There's breaks for questions at the middle and at the end of the presentation today, and we'll get back to you if we don't get a chance to respond to your questions. You'll see there's a question box or a little orange arrow that you can click on in order to submit your questions today. Let's look at our agenda for today. We'll start by talking about what is the evidence review process. We'll talk about what evidence you should upload and how to upload it. We'll look at peer assessor matching, what happens if there's missing or incomplete evidence, and then what happens after the evidence review. We really wanted to point out that everything is available on the homepage. Everything we're talking about today is in the evidence review guide, and the way that you get there is at castlepost.com. Hover over the word registrants and go down in the middle to peer assessment program. At the top, there's information on the evidence review process. There are some guides, but the most important one for you is the evidence review guide. It's available in English and French and talks about clinical and non-clinical evidence reviews. So again, we wanted to start with answering the question, why does CastlePost make us do peer assessments and quality assurance? It's not a CastlePost decision, but it's legislated by the Regulated Health Professions Act. So all 26 regulated health profession colleges do some form of peer assessments. So your chiropodist, optometrist, dentists, everybody has quality assurance and peer assessments. And why are we adding evidence reviews? Quality assurance measures audiologists and speech language pathologists' knowledge and skill to ensure they're meeting CastlePost standards of practice. We support registrants' improve practice by providing education and resources, and assist registrants to improve their skills so that you can provide safe, effective, and ethical care. But we are a small college, so we're only doing peer assessments for about 2.5% of registrants, which is not statistically significant. CastlePost needs to increase the number of registrants that take part in quality assurance to strengthen public protection. If you were in another regulatory college, you would actually have a likelihood of getting selected more often, as they assess more people than CastlePost. Indicators selected for the evidence review are based on risk of harm and are higher risk to the public if standards are not met. We have data on all these indicators that registrants need more support with, so we're focusing on those. Out of the 30 clinical indicators that are on the SAT, clinical audiologists and speech pathologists are being asked to upload for 18 indicators. For clinical evidence review, for non-clinical, where there's 22 indicators, it's only 14 indicators that you're uploading to this year. And out of these, the peer assessors will be looking at evidence for pre-selected indicators. Speaking of peer assessors, They have all been peer assessed themselves and know exactly what it's like to be in your shoes. They then went on to become peer assessors. Peer assessors go through annual training and take on a number of peer assessments over the year. They are warm registrants who want to give back to the professions. Peer assessors and this process are not out to get anyone. The process is not punitive, and it can be a very positive learning experience. In the evidence review, there is less interaction with the peer assessors than in full peer assessments. Peer assessors will reach out to you through email when you're first matched to say hello and let you know when they're planning to look at your evidence. They will also be in touch through email if there's any missing or insufficient evidence. If they're satisfied with your evidence, you may not hear from the peer assessor again, but receive a synopsis instead. More on that later.
All right, thanks, Dana. So what we want to do now is focus on what you will be doing to prepare for this evidence review that's going to take place. And so Dana is showing the self-assessment tool, which should be familiar to everybody. Many of you might have already submitted your self-assessment tool. Just a reminder that that is due this Wednesday, January 31st. You must submit it by then. But because you've been selected for evidence review, even after you submit on Wednesday, you will still be logging in and going in here and working on the tool, preparing for the evidence review. So let's look first at the practice description section. You would have filled this out when submitting the tool, but this is very important. In fact, for evidence review, the self-assessment tool is particularly important because this is the eye that the peer assessor has into your practice and into who you are as an audiologist or speech language pathologist. Because as Dana said, you will not have the virtual interview that happens in the full peer assessment. For evidence review, the peer assessor will go into your SAT and look at it and look at those pre-selected indicators, but you will not be speaking to them directly. So please ensure that you fill out this practice description section with a lot of detail. Indicate your service settings, indicate your service delivery model. If you work with support personnel, the age range of the patients that you work with. For audiology practice, there's many areas of practice. You can check mark all of them that apply to you, and same for speech language pathology practice. And then at the bottom of this section, you'll see there's a box that says provide additional details of your practice. This is very important because, again, this is what the peer assessor can look at to learn anything unique or different that you want to share about your role that maybe isn't captured by the other section, by the other parts of this section. So maybe you work in interesting teams, maybe you see very unique patient cases. This is where you should put that detail. Now in section number 9, very important that you include a current email address where it's easy for the peer assessor to reach you, because as Dana explained, that is how the peer assessor is going to be communicating with you. And all of the other fields are, of course, need to be filled out, but email address, make sure it's current. And then you'll notice there's a section at the bottom, evidence review only. Your peer assessor may complete your evidence review anytime between April and December. Will you be away during this period and unable to respond if necessary? And so please put in there, if you know you're going to be away during a certain time, maybe you have a trip planned, maybe you go away every summer. So please put in there when you will be away so that the peer assessor can do the evidence review, can work around that. Because if they need to reach out to you, they don't want to be doing that when you won't be able to respond. All right. So the other thing that this section is used for that's important is for the peer assessor matching. So we'll talk a little bit more about that later. So let's move on now to the professional standards section. So this is where the bulk of your work is going to be happening as you prepare for the peer assessor to review your evidence. So this should be familiar to you. This is where all the professional standards indicators are. You are rating yourself on the standard, reflecting on your practice, and then you're uploading your evidence. So let's have a closer look at indicator 1.2. Just as an example, this is I maintain records in a reasonable time, which accurately reflect the services provided. Each of the indicators will have guidance and examples on meeting the standard. So the guidance gives you documents you can read to understand the standard better. Examples are things you can do to show that you meet the standard. So you'll be assigning yourself a rating, and then you'll be uploading your evidence. And you'll notice that for the indicators where evidence is required from the patient record, it will say so. Okay, Dana is showing us that. And then very important for evidence review, the comment box. So you'll be putting comments in to explain your evidence, to explain how that evidence connects to or reflects the standard that you're filling out. And then you can put more details in there if you'd like. We're not expecting you to write big, long, statements, but as much as you think is needed in the comments to really get across to the peer assessor how you're meeting that standard in your practice. So a couple of important things to note here as well are that you want to make sure you're uploading your evidence for the 2024 SAT. At the top, it should default to the year 2024 already. But please make sure you're uploading your evidence to 2024. And you're working on uploading this to the deadline of March 7th. So by March 7th, you must have all of your evidence, comments, and ratings in for the standards that need to be filled out. Again, as Dana said, these are select. It's 18 standards for clinical evidence reviews. It's 14 standards for non-clinical evidence reviews. So here Dana is showing us the evidence review guide, and there are tables in there that also show you which indicators require evidence from the patient record and which indicators are the ones that you need to work on. There's a chart for clinical evidence review, and then there's one below for non-clinical evidence review. A note about non-clinical evidence reviews, you'll notice here, none of them say from the patient record. Of course, because you're non-clinical, you don't have patient records. So, but you still do need to upload evidence that shows how you meet these standards and use the comment boxes to explain. And you will be matched with peer assessors according to that. So peer assessors who do non-clinical peer assessments will be matched with non-clinical registrants. So a couple more notes about the evidence. We want to see filled out information, so filled out forms. This is some direct feedback that we've received from the peer assessors. So for standards where you're uploading, for example, consent forms or case history forms, don't upload blank forms. Ensure that you upload forms that have been filled out with patient information, because blank forms are not informative for the peer assessors. The peer assessors want to see how you're using those forms in your practice. So forms need to be filled out. The evidence that you upload needs to come from a minimum of 5 patient records, because the peer assessors want to see a broad picture of your practice. So evidence should not come just from 1 record. It should come from 5. And the more current the evidence, the better. So in the last 3 years is fine, but more current is preferable. If you work in more than 1 place, you can upload evidence from both places where you work. So as you can see, the evidence is key in this process. All right. We have uploaded a handout which has tips from the peer assessors for uploading evidence and other tips that you will probably find very useful. So you can click and download that now if you'd like. It's attached to the webinar. So the next thing that we'll talk about is how many pieces of evidence per indicator. So we are asking for 1 piece of evidence for all of the different indicators that you are uploading for. The best piece of evidence that you can find to reflect that you meet the standard. There are two exceptions to this, and we can see those in the chart right now that's up. So there's two indicators where we are asking you to upload more than one piece of evidence. The first one is 1.3, which is applicable to audiologists. So this is I perform and document the controlled act of prescribing a hearing aid for a hearing impaired person, according to practice standards and the position of the college. So for this practice standard indicator, we want 8 pieces of evidence. It sounds like a lot, but let me clarify. We want one piece of evidence showing the 4 different phases of hearing aid prescription. So a piece of evidence to show the hearing aid assessment, one to show the actual prescription for the hearing aids, one for verification, and one piece of evidence for validation. And you're pulling that from 2 different patients. So in total, that's 8 pieces of evidence. The other indicator where we are asking for more than one piece of evidence is 1.5. I am accountable for support personnel providing intervention under my direction. And this could be applicable for speech language pathologists or audiologists. So for that standard, we're asking for 2 examples of evidence showing different aspects of supervision. So it could be co-signed patient records that reflects that you've been supervising the support personnel. It could be consent that you've documented to involve the support personnel in patient intervention. It could be a calendar invite showing that you meet with the support personnel frequently, but that evidence must be 2 pieces and reflecting different aspects of supervision. So other than those 2 indicators, all of the other indicators for both clinical and non-clinical peer assessment, we are asking for just 1 piece of evidence. Okay, I think, Dana, have I missed anything? Otherwise, I think I'm passing it over to you.
Nope, sounds good. So now we can go through together on how to upload evidence and what exactly to do. So what we recommend is having the evidence saved on your desktop. I know lots of people like to create a folder so that everything is there and you upload all at once. It also means that if you want to change any of your evidence or you put something in the wrong place, you always have access to it as opposed to just throwing it in another way. And having it saved on your folder will give you the chance to rename it. So for instance, we like to say to put on the standard number because that make it easier for you to find what you're looking for. And also you might not want to have the patient's name in the name of the evidence, but rather patient record 1, patient record 2. I'm saying this, if you've already started uploading evidence and you have not used PR 1, 2, 3, 4, 5, don't worry about it. You do not need to go back and change it. But let's say, so here I have my evidence, some of my evidence ready, but I'm going to go back and take out the name of the patient and make it PR1, just so that it matches everything else. It already says what it's for, so now I have all 4 records needed for one of the patients for 1.3, as Samita was talking about. We can also see, we have questions about how much of a record should I be uploading. Samita said 1 piece of evidence. For the others, we really cannot stress enough, 1 piece is enough. Things like I maintain records in a reasonable time, which accurately reflect the services provided. 1.2, often people will say, well, I want to upload a report and I want to show the chart entry to show that I wrote the note the same day that I saw the patient. Oh, and I also want to upload something to show that I did it late and I write down that it was a late entry. Just pick one. What's one thing that best represents you as a clinician? So we can even look at one of the pieces of evidence. Sorry, that is a picture of my daughter that just came up. Oh, I think I closed the evidence. Okay, so we can look at 4.3, some evidence that we made up, as you'll see, as it opens. So this 4.3 is I communicate respectfully and collaboratively with patients, families, caregivers, registrants of my profession, other professions, and or coworkers and employees. So here we have something that came from the SLP's records, and the SLP fits the CAT wanted to upload this for 4.3 to show communicating respectfully and collaboratively. They highlighted, spoke with Darius Duck, the occupational therapist for the patient. And so even though they put in this whole page, they highlighted the area that they want the peer assessor to pay attention to. So instead of just blocking everything else out and just having a little snippet, the whole thing is there, but it's been highlighted to show. So other notes from the peer assessors are to be very careful that when you upload your evidence, you can use this folder to make sure you haven't uploaded anything upside down, so that you can turn it and get it all ready so that it's good to go for the SAT and the peer assessor. You can take photos of evidence and send it to yourself via email or text, upload the file, and then be sure to delete the file from your phone or how you sent it to yourself. If you don't know how to do this, you can get some IT support. You can take screenshots. You can really figure out the way that works best for you. As Samita said, be sure to use the comment box. And we can even upload something now. So let's go to 4. I have something for 4.2. I communicate in a manner that is responsive to the diverse background, identity, and experiences of the patient, families, caregivers, and other professionals. So to upload, you click on the blue required for peer assessment. You'll notice that this one doesn't actually have to be from patient records. A little box will pop up. So you choose your file. And it will ideally take you to the folder that you've been using. So this is 4.3. So I will put in, oh, well, that is interesting. Okay, sorry, this is 4.2. I was on the wrong one. So choose file, it says here, upload the file. And you can see that it's here. And so again, using a little comment box, I might say this is a handout I made for a 6-year-old child and their family who speak Urdu. Visuals and pictures with words in both English and Urdu. So this is a great explanation to the peer assessor on why I chose this evidence. Again, as Samita said, it's not a whole long story, but just something very brief to let them know why I chose it. So we're all set. I've done 4.2, and let's say that the computer didn't bing and actually 4.3 is what I uploaded by mistake to the wrong one. If you need to delete evidence or you have new evidence that comes up before March 7th that's better, then you can click on the little red stop sign. The box will come up. Are you sure you want to delete the file? Okay, and then it's gone and you can put in the right thing. And probably a good idea to delete the comment as well or change it to be the right one. So again, if you have new evidence that's better, you can add and remove the first until March 7th. And I see a question has already come in saying, what if we've uploaded evidence and something better comes before then? Absolutely, you can change your evidence and you have until March 7th to do so. We also often get the question on redacting information. And so we wanted to point out that the Regulated Health Professions Act supersedes FEHIPAA, and the SAT is very, very secure. However, if you want to, you can. We often hear from hospitals that they have concerns about uploading personal health information. If you or your employers have concerns, have them call us. There's no harm in sharing with your privacy officer or employer about needing access to files. In fact, because all regulated health professions have peer assessments, hospitals and larger organizations will already be familiar with the process. We have a letter to employers on the website, on the page that we were looking at before. The Self-Assessment Tool Company has an IT jargon letter that we can provide to you and to your employers. It's very technical, which is probably what they want, but we might not understand it. But again, the self-assessment tool is very, very secure. There's no need to redact information. You can maybe take out addresses and names, but it's important to keep the date of birth, say, or some information that might be important. You don't want to submit something that's all blacked out with just a few lines here and there. The other thing is that you do not need patient consent in order to use their records for evidence reviews or any form of quality assurance. Okay, so I think we can stop for our first question break.
Yes, just having a look at the questions.
I see one on, is it possible to make changes to the practice description once the SAT has been submitted? Absolutely. So we wanted to make it clear that once you submit your SAT, because it's due on January 31st, definitely need to get it in by then. When you submit, if you want to change something, if you want to change your practice description, if you want to change the evidence or even upload evidence, you still have till March 7th. So how can that be? As long as you hit you hit save on the self-assessment tool, you don't need to resubmit. So submit by January 31st and just hit save every time after that for each of the pages.
Yes. I see a question regarding one piece of evidence. Is it okay to upload a note from the patient record that says, gave them a handout with instructions, and then separately upload the PDF handout? So if you could do it just with one piece of evidence and then use the comment box, that might be a way to get around having to upload more than one piece of evidence. Dana, tell me what you think. If somebody feels like to get the really full picture to the peer assessor, you want to upload the handout as well as a note from the patient record. We don't want to be, so restrictive that we're saying absolutely not. It's less work for you and less work for the peer assessor if you're not uploading tons and tons of evidence. As Dana showed, it's also really useful if you show in the piece of evidence that you upload what should be focused on. So if you really feel like you need to, you can, but please try to keep the evidence limited as much as possible. Dana, what do you think?
I think that makes sense. Again, comment box. I think that's the best idea, Sunita. If you feel that you need to upload 2 pieces of evidence, then at least use the comment box and say one piece is the note saying that I gave a handout and the other is the handout. I think if it's the handout that you're showing, that's enough. That's what the peer assessor will probably want to see if that's what you're looking at.
And one more question. Yeah, are you looking at it? It says, can we upload evidence from this year 2024? And the answer is yes, and hopefully that's been made clear. 2024 evidence is great because we're in the year 2024. That's as current as it can get, but you can have evidence from the last 3 years. The more current, the better.
Yes, and as always, I see some advertising questions have come in. One is, I don't advertise because I have a small practice, so we just go by word of mouth. If you're saying that advertising or any of the indicators are not applicable, then you do not need to upload evidence for it. If it's something that you think might confuse the peer assessor, then you can always make a comment. I have a small practice, I don't have a website, I don't advertise, it's all through word of mouth. Use the comment boxes. There's another one here, Sumita, I'll pass it to you as an audiologist. I don't advertise because I work as an audiologist for a big company and I have no say in advertising. We get this question every year.
Right, yeah, so there are a lot of audiologists who are working for companies or clinics where it's the clinic and the company that develop the advertising, and you really don't have much to do with that. However, it's important to keep in mind that that advertising reflects your practice. Okay, so although you don't make it or write it, it reflects you. So that advertising does need to be compliant with CASLPO standards, and you need to make reasonable attempts to make sure that it is compliant. So the peer assessors are going to be looking for that. That advertising is still something that you need to be talking about. Okay.
Absolutely.
Yeah.
All right. Let me share my screen again. There we go.
Okay. So where we're at now is we've covered what is an evidence review. We've covered what evidence to upload and how in the self-assessment tool. So now we're at number 3, peer assessor registrant matching. So this is where we just wanted to tell you a little bit about, while you're working on your SAT until March 7th, to upload everything, what's sort of happening behind the scenes. So what's happening here is we are training the peer assessors. So there's new peer assessors, they receive some extra training. The big group of peer assessors receive a big training session. They get lots and lots of training for this. And then the other thing that's happening is we're matching you based on your SAT. So that's why that practice description section is so important. We are matching the peer assessors based on profession, based on the area of practice or areas of practice that you work in, and then based on language. So if you're a French-speaking if you're a French-speaking registrant, we match you with a French-speaking peer assessor. So in March, we will send you an email with your peer assessor's name and a link to them on the public register. And you can veto the peer assessor one time. That information remains confidential, only staff would know. But then we match you with another peer assessor, and that is the peer assessor that you will be working with. So you get one veto. Once you are matched, your peer assessor will send you an introductory email to tell you when they will be looking at your evidence. So again, you are communicating, the peer assessor is reaching out to you by email only. There is no other interview or anything like that in this evidence review process. All interaction happens through email. So continuing with that, let's move on to number 4 now, which is missing incomplete evidence, something that we refer to as virtual remediation. So let's talk about when this would happen. So imagine the peer assessor has gone in, they've looked at the evidence for the indicators that they're reviewing, and they might find that they want to see more, that they feel that you need work to meet the evidence. The evidence that you have in there is not really showing them that you have met the standard. So what they will do in that case is they will send you an email with some guidance and an explanation. So it will explain which professional indicators they want to see better evidence for. And then that email will also contain some guidance and some education. So please have a look at this article, please have a look at this CASLPO document. And the idea is that this will guide you on what should be included and how you can improve your evidence. So for example, the peer assessor may want to know more about what you say when you obtain consent from patients. Maybe the evidence you've uploaded is not informative enough for them. So they will reach out and ask you for that additional information. You will be given 4 weeks to upload that new evidence, and the peer assessor will CC Dana on that email, and we'll let them know that that's something that's taking place. So you'll have 4 weeks to think about it, to do the reading, and to upload some better evidence showing learning through this process. So to give you an idea of some of the indicators that have required virtual remediation last year in evidence reviews, they are listed here on this slide. So record keeping, indicator 1.2, 1.5, I'm accountable for support personnel. So there are checklists in the SAT. We encourage you to use those as resources, but these are the indicators that have required that remediation. So again, if this happens, it's an opportunity for learning and improvement. It's nothing to feel bad about. This is the whole point of quality assurance. It's, the peer assessors are not looking for mistakes or anything like that. As Dana said, they're very warm, colleagues who are coming in to provide guidance. So use this as an opportunity to meet the standard. And make sure that if this happens, like let's say it's pointed out that something is missing in your record keeping, don't just correct that for the evidence that you upload, but you can apply that to your practice since that's something that you've learned. So carry that learning forward. So I develop a professional network. That's an important one. And then you can see the indicators for consent have received virtual remediation last year.
Exactly. And I think it's virtual remediation, both in evidence review and also peer assessment. These are ones that come up relatively frequently. So now we can move on to what happens after. You've done your evidence, your peer assessor has done something or hasn't done something in an email with you. What happens next? So after the peer assessor has reviewed your evidence and provided any virtual remediation, the peer assessor will write an evidence review synopsis. They cannot tell you if you were successful. That is determined by the Quality Assurance Committee. The synopsis is very short. It will indicate which standards were reviewed, which are met, and even if there was virtual remediation, if the peer assessor feels that further work is needed after the virtual remediation, it will be described in the synopsis. You are sent a copy of the synopsis, and you have a week to provide a response to the Quality Assurance Committee if you like. The synopsis and any information you send are anonymized. The Quality Assurance Committee will not know your name. They'll just have a peer assessment number. And you'll probably see this number on a lot of the things that you're given from CastlePo, is that you'll know your number 1, 2, 3, 4. The Quality Assurance Committee will direct you on how to proceed after they review the synopsis. They'll decide if they need more evidence or if you have demonstrated the required knowledge, skill, and judgment based on the evidence that you've provided. The committee meets approximately every 6 to 8 weeks, starting in April. So you might have to wait up to 2 months, depending on when the evidence review is completed. You will receive an email after the Quality Assurance Committee meeting letting you know the final decision of the committee, hopefully congratulating you for completing the process. Once the process is finished and you have the letter from the Quality Assurance Committee, you cannot be selected again for evidence review or for peer assessment for 5 years. So for 5 years after this, you are taken out of the pool and you will not be selected. And if you are in error, just let us know and we'll certainly make that correction.
And then finally, you will get a survey. Right, Dana?
Yep, absolutely.
Yes, okay. So the survey is going to go out to you once that whole process is completed, after the Quality Assurance Committee has reviewed the synopsis from the peer assessor. And we know that registrants, I mean, we're all receiving surveys all the time. Sometimes it feels like, I don't really want to fill out this survey, but please do fill out that survey for us, because this process is new for CastlePo, the evidence review, and we really, really need to know how you found it in order to improve it, to make it better, to make it more effective. So take some time and fill out that survey, because your feedback is very invaluable to this process and for the future of this evidence review. So I think it's time to look at any more questions that have come through.
Absolutely. And please do send questions. If we don't get to it today, we can answer you individually. Sometimes questions are very individual, and so it would be better just to answer after, I would think. Let's see. I see. What did you say? If an indicator does not apply, for example, I do not work with or supervise CDAs, so would not have evidence on how to support them. So if something does not apply, like supervision of support personnel, and you put NA, there's no evidence to upload because it's not applicable. If you work for a hospital or a school board and you don't have, there's no advertising for school board, then you would put NA for 4.5 advertising and you wouldn't have any evidence to upload. If you feel that a comment is helpful, like I work for the school board and we don't advertise, then there you go, you're welcome to make a comment, but hopefully that should make it a little bit easier on you and on the peer assessor as well.
Okay. Can I use different parts of the same piece of evidence for different indicators? Body of the email for one indicator and email signature from the same email for a different indicator? Yes, you can. You could do that.
You can. I would say actually,
yeah.
On the other hand, because you're just uploading up to 18 or up to 14 pieces of evidence, then it might be nice to show something different. Just
that's true.
As a way to show, although the signature of an email, it doesn't matter if you use the same email for one or another, as you had an example.
Yeah, I agree, Dana. As we said, pull that evidence from a broad range of things. So five patient records you have to use, but yeah, if one piece of evidence is working really well, you could do that potentially. Okay, how long is the interview with the peer assessor? So just to clarify, this is about evidence review, which is different from the full peer assessment. So this webinar is about evidence review, and there's no interview in evidence review. There's only email communication with the peer assessor. We would also encourage you, if you have questions, like let's say, for example, you get that virtual remediation educational email from the peer assessor. If you have questions about what the peer assessor is asking for, please contact us as staff, we would, yeah. So there's no interview. I hope that that clarifies.
I think that's a really good point, Samita, and I'm glad you said it. If there's a few takeaways that we could give you today, it's one piece of evidence, upload to 2024, choose your best evidence. And also, if you have questions, reach out to Samita, reach out to me. Sadia is the admin person for quality assurance, and we're all happy to help you along the way. It's probably easier and you'll get a quicker answer emailing us than you might reaching out to the peer assessor. So that's definitely what we recommend.
Sure.
Can we submit evidence for more than 5 patients? Sure, absolutely. It has to be a minimum of 5 patients, so that, as Samita said before, the peer assessor gets to see what your practice is like across the board, as opposed to getting just 1 or 2 files ready.
Mm-hmm. This is an interesting question. Is it okay to need work to meet the standard? So I would say, and I would wonder what you think, Dana, too. This process is really wanting to see that you meet these standards. So what's happening is, if you're selected for this process, throughout this process, by the end of it, you should be meeting that standard. I think that you should do your best to show that you meet the standard and see what the peer assessor's comments are. I mean, that the role of the peer assessor is to basically verify that. So if there's something missing, then the peer assessor will identify it and let you know through the remediation process. But yeah, I think one of the things that quality assurance is doing by selecting people for peer assessment and evidence review is that encouraging you to go through the learning process of meeting all of these standards. Dana, what would you say for this?
I agree, but I think that if you feel you're not meeting a standard, absolutely say that on the self-assessment tool. Peer assessment and evidence review aside, it is a self-assessment tool, and it's a way for you to decide what it is that you need to work on in your profession. If there's something not meeting the standard, you should absolutely be creating a learning goal for it. If it's something you need to upload evidence to and you still think you're not meeting it, then definitely say you're not meeting the standard, and know that the peer assessor will probably send you an email, but it's going to be a helpful, supportive email, because the idea is exactly that we want you to be working at standard. You need to be working at standard, and if you need help, get it for sure. And peer assessors are a great way to do that.
Yeah, I totally agree. I mean, yeah, this is an opportunity to learn, so you should be honest about that. So I totally agree with that too.
Yeah. We have a question about uploading evidence for learning goals and CLACs. Your peer assessors are not going to be looking at your learning goals and looking at your CLACs, your continuous learning activity credits from last year or from this year by March 7th. If you have CLACs for the year already, you can certainly write them in. If you have evidence, you're welcome to upload it, but it's not something that they're specifically looking at. They might have a look just to see if the SAT is completed overall, and so you can certainly upload things, check your progress to meeting the goal and the impact on your practice. All right, so we'll go to the next slide and we'll see if there's any more questions before we finish. But we just wanted to remind you that this is where we have lots of resources available on the CASLPO webpage, on the CASLPO website. So we look together at the evidence review guide. There's the information for employers that can be helpful if they're wondering why you need access to files. But again, everyone is welcome to reach out to me. It happens every year. And we also wanted to leave with the idea of to use your best professional judgment for what to upload. You don't need to check with us, is this the right thing to do? Talk to your colleagues. You can be creative, but definitely use those comments. And if the peer assessor needs something more, then they'll let you know.
Yes, yes, we hope that, you know, as Dana said, people go through this process and really do learn a lot from it. And we hear from a lot of registrants who say, I was really anxious and when I got selected, but by the end of it, they really felt like it was a useful process to go through, despite the work that's needed, you know, all of that. So I just did want to say one thing, which is that you will have access to your SAT to upload evidence after January 31st. It will not be locked. You have to submit it by the 31st, but then you'll be able to log in and work on uploading your evidence. Regarding the list of documents to read, should we review them all each year? So you should be aware of all of the documents that are relevant to your practice. You don't need to read every single document each year, but you need to be aware of where they are, how to find them, and you should be reviewing the ones that are most relevant to your practice each year.
And of course, there's always one that is required reading. This year, it's the standard on use of restricted titles, so that you do need to read. And if you want to review every document that's relevant in January of a year, absolutely, that's a great way to do it. But the idea behind the checklist is to check the ones that you actually did review within the last year. And maybe you can look at last year's answers and say, oh, I haven't looked at that in a few years. It's time to go back again.
So I think this brings us to the end of the session. I don't see any more questions coming through. Oh, maybe there is one. Let's just see.
Nope, I don't think so.
Nope. Okay. So there's information here on how to contact us. You can contact qualityassurance@castlepo.com. Dana's email is there. My email is there. If you have questions as you're working through this process, please reach out to us. And we wish you all the best of luck with this process, and have a good rest of your morning.
Bye. Thank you.
Take care.